Louisiana Living on Fox 14 continues.
And welcome back to our segment, Life Without Limits. And joining me is Dr. Ron Ellis with Louisiana Pain Care here in Monroe. And today we're talking about shingles. And I know that affects a lot of our viewers, a lot of people out there.
Just about everybody knows someone who's had the shingles.
Well, thank you so much, Dr. Ellis, for joining us.
You're
Let's
welcome.
start with explaining what causes shingles.
Interestingly, the virus that causes shingles is the same virus that causes chickenpox that we get almost uniformly as children. It's a weak virus that once its course has run with the chickenpox, it actually lives in your body for the rest of your life. And our immune system keeps it in check until we get older, when our immune defenses start to weaken, and for a variety of reasons the virus can then break free from the nerve areas that it's located and travel along those nerves and create the shingles.
And what are the symptoms?
Acutely, rash, although some cases of shingles can occur without the rash, pain, itching, numbness in some cases.
How is it? I know it's very painful.
Extremely.
Extremely. How is it treated?
Acutely, nowadays, is treated most commonly by a person's primary care doctor. The first course, first line of treatment is antiviral medications such as Valtrex and steroids in some cases.
But I know the pain lingers even after the shingles have gone away. How does Louisiana Pain Care come into play when treating shingles?
We get referred a lot of patients with something called post-herpetic neuralgia, which simply means pain after the acute phase. It's not qualified as actual post-herpetic neuralgia until it's been present for at least 120 days, according to most recent definitions. But the primary aim we try to shoot for nowadays is to actually prevent the post-herpetic neuralgia from occurring by attacking or approaching the treatment of the acute phase as quickly as possible. And that's done in a variety of methods, but in our hands, interventional therapies such as various types of pain blocks, epidural injections, paravertebral nerve injections, sympathetic nerve blocks, all have been shown in some studies to effectively reduce the risk of post-herpetic neuralgia from even occurring.
And what is your advice for patients who, if they do get shingles or if they have shingles, when should they contact Louisiana Pain Care if they feel like the pain is lingering?
Simply put, I would say as early as possible. We've tried to educate the referring physicians out there who see these patients probably sooner than any other specialties, and have tried to get them to refer patients to us as soon as possible, especially those with facial shingles, which can be devastating. I've seen patients actually lose eyesight because of the virus getting in the eyes. So if you can effectively approach that with appropriate injections, you can literally reverse the course within a day or two.
And when should you get a shingles vaccination?
Current recommendations are anyone over the age of 60 should get the shingles vaccination, which is just a stronger version of the chickenpox vaccination. But here recently, they've actually been recommending even people as early as age 50 consider it.
All right, Dr. Ron Ellis, thank you so much for joining us.
You're welcome.
It's very useful information.
Thanks.
And coming up next, we'll tell you about the World Changes Tour. Stay with us.